With another in her series of updates on healthcare topics, this time on plastic surgery. Here's our reporter, Laura Windsor.
A morbidly obese person can opt for bariatric surgery, resulting in substantial weight loss, but also leaves excess hanging skin. Fortunately, there is a post-bariatric surgery that removes the excess skin. We spoke with Dr. Bruce Cads to find out about this procedure.
Bariatric surgery is basically a weight loss surgery. It's now minimally invasive type operations that have come about. Very well done, very safely done most of the time, and it allows the patient to lose a great number of pounds over a short period of time. They basically call it gastric bypass or the formal quote-unquote bariatric type surgery. There are different types. After the plateau phase has passed and they have lost all the weight from the bariatric surgery, the weight loss has occurred, patients come in typically complaining of, now doc, what am I going to do with all this? This hanging belly and this hanging arm, my neck, my eyelids are drooping, my breasts are down to my knees. What am I going to do about that? These are basically the challenges that will face you as a plastic surgeon following bariatric surgery. You walk them through their options. You start from head to toe. You describe, what can be done for the facial region, their arms, their breasts, their thighs, their abdominal region. You give them options of how all these problems can be corrected. And by and large, most of them can be corrected. These are before and after photographs of a patient that has undergone this bariatric type surgery with weight loss. Typically, these patients come in with what's called a pannus, which is the drop part of the lower portion of the abdominal area or the skin excess. It's not the only problem. This lady has also had multiple pregnancies in the past, and if you really look at it, there's a bulge of the abdominal wall that has occurred independent of this type of a weight loss. So not only you can tackle the problem of the saggy skin and the fat that has occurred after the weight loss, you can also undo some of the things that have happened to the patient following their multiple pregnancies. You look at the after photograph, this clearly shows that the skin and fat that has been excess has been removed. The scar has been strategically placed within the underwear or a bikini line, or whatever you want to call it. You can tailor it into that, and following that, you see that not only the skin and fat has been removed, you've also had a contouring of the bulge that has come about after pregnancy has been corrected with this operation. So there are multiple facets to this result. These are the type diving shots that really do show the entire problem. It almost looks like a mile of skin excess and a lot of fat. So we do take these shots to really demonstrate what the real problems are, and it also helps us with a before markings before we go into surgery, how much of the skin we can remove. Not only it depicts the problem, but it also helps us determine how much skin and fat we're going to remove. I had a specific patient that following a month after this operation came back with, she used to never put any makeup on. She comes back with the makeup on, with high heels, walks around, talks to people, absolutely vibrant. So it really does change their lives. And I feel very lucky to have participated in their care.
The results from having post-bariatric surgery are remarkable, and the best part is you feel good too. I'm Laura Windsor for the American Health Journal.